inspiring people with curious minds, harnessing data and technology, working seamlessly and inclusively, always learning from patients. AstraZeneca R&D, helping unlock the power of what science can do.
AT&T is helping business move forward, and together, we've changed the way things get done. From redefining collaboration, top of the line here, to coming up with new ways to serve customers and deliver products.
This one is cheddar. It's delicious.
So as your business keeps moving forward,
Oh, you look so healthy.
you can rely on the people and the network of AT&T to help keep your business connected. Let's take care of business. AT&T.
Thank you for joining us. Our program continues now.
Good morning and welcome to today's panel on community partnerships at work and employing public health strategies. Thank you so much for joining us today. I'm so excited to be here. My name is Nicole Palya and I'm the Regional Director for PhRMA. We are the trade association that represents 34 biopharmaceutical companies with cutting edge technologies that reach across the globe. Thank you so much for joining us today. Right now, I would like for you to watch a short video about some of the things that PhRMA is doing every day to improve your lives and improve the companies who are involved with the Maryland Tech Council. We can go to that video.
Right now, we're tackling some of the hardest challenges of our time and finding answers to the questions that impact every community. In the biopharmaceutical industry, developing life-saving treatments and cures, working to help those in underserved communities, and supporting patients in need are all just a part of our everyday life, and we need your help. We're working to provide better access to our industry and to make more opportunities available than ever before. We're offering scholarships to make education accessible. We're putting more resources into our communities and providing support and mentorship to those who need it. If you're looking for a career in medicine, business, or marketing, then you have an opportunity to create change and save lives. We're fighting to drive research and innovation forward while paving the way for progress. And we know this can only be achieved when we fully embrace diversity, when we make it part of our DNA.
Great. Well, thank you so much for watching that. And I think the greatest takeaway there is that we all work together to create change and save lives. And today I have the luxury of my two panelists with me today, Angelique Griffith with Gilead and Lily Cappelletti with AstraZeneca. So ladies, thank you so much for joining us today and talking a little bit about the incredible programs that you guys are involved with. If this epidemic has done anything, it's taught us to really take a deeper dive into what our companies can do, what we can do as individuals to address inequities. And it all starts with our communities and getting involved and taking a deeper look into what our role is there. And so first, I'd like to kick it to Angelique to talk a little bit about the FOCUS program. Angelique is the FOCUS Regional Director for Maryland, Washington, D.C., and Connecticut. And I'm really excited to hear what you have to say today. Angelique?
Thanks so much, Nicole, for that wonderful introduction. I'm really honored to be here to share about our FOCUS initiative. Here at Gilead, we pride ourselves in making a commitment to partner with community and to addressing the public health crises ourselves as a private organization. As you mentioned, it's a great need that we partner in this time, specifically in COVID. The FOCUS initiative is an initiative that was designed in 2010 to ensure that organizations such as hospitals, community health centers, and health departments could participate in screening and linkage to care in a way that was routine. So the Centers for Disease Control established guidelines in 2006 that persons living with HIV or anyone encountering healthcare systems should have access to testing routinely without need for extra communication around counseling, but just to make diagnostic services broadly available. And so the Focus Initiative stepped up to see if we could partner with organizations to help them achieve that goal. And so throughout the country, Focus has established over 380 partnerships with organizations that establish a model using core principles of testing that is integrated into the standard of care, using their electronic medical record technology, making sure that it's something that is adopted as a systemic policy, that there's not a special protocol, that this is not research, that this is just making sure people have an opportunity to learn their status, and sure that there's training and quality improvement always going on in the background so that every person has access. Over the years, we've gone from emergency departments and clinical settings exclusively to adding a large amount of community-based organizations who are partnering with public health organizations by making screening available to the community. We realize that COVID has put in place some limitations from our public health infrastructure on how we can provide core services such as testing, such as outreach to communities, as those staff and health departments have been shifted to address COVID needs around testing, around immunization or vaccinations, and just doing contact tracing, monitoring the epidemic. We want all of our organizations to have an opportunity to participate in addressing these public health crises. So Focus established a model that we call it the TEST model. And it is something that has been disseminated broadly. It's being used throughout the country, here in the US and Spain and Portugal. And it's shown that it has a significant impact on improving outcomes for people living with HIV or viral hepatitis by diagnosing them early. So today we want to highlight one of our organizations who's done a great job in the midst of the pandemic here in Maryland, where we have 21 partnerships that are doing focus activities, whether it's in a hospital, a primary care practice, community-based organizations. This particular partner is Adventist Healthcare's Fort Washington Medical Center, located in Prince George's County. This hospital has been really impacted by COVID in that they had major staffing limitations, major capacity limitations, but yet they still felt the need to keep these things a priority, and has significantly benefited the community as a result. Let's take a look at their video.
In partnership with Gilead Sciences, Adventist Healthcare Fort Washington Medical Center launched its HIV and Hepatitis C program in 2016. The goal is to provide a platform for our patients to confront diagnoses and begin exploring treatment options.
Prince George's County was heavily impacted by the COVID-19 crisis, and our hospital was no different. While we scaled back some of our community programs, this one kept going.
This program is a first line of defense for the patients we serve. According to the Maryland Department of Health, more than 9% of females living with HIV in Maryland remain undiagnosed. Further staggering, Prince George's County has surpassed Baltimore with the highest rate of new HIV diagnosis in the state. With the extra attention and resources focused on the pandemic, we became extra vigilant with our continued screenings, ensuring patients who tested positive were linked to the necessary care.
I'm the first face patients see when they walk through our hospital doors. My smile and compassion for their well-being is a critical part of our program. I, along with the triage nurses, sit down with patients and talk with them about getting tested, making sure they know the test is free and confidential. I get it. I know all too well, in fact. My son has been living with HIV for 12 years. I want every patient to know they have options, and we can link them to life-enhancing care after a positive diagnosis.
Adventist Healthcare Fort Washington Medical Center is a community hospital. Our mission is to extend God's care through the ministry of physical, mental, and spiritual healing. We cannot do this alone. And we are grateful to Gilead for enabling us to confront these serious illnesses that disproportionately affect patients we serve. Our purpose has been to help patients in our community confront illness and then work towards healing through the linkage of care. We are committed to care for our patients through the COVID-19 crisis and beyond.
The video you've just seen was actually produced by the Fort Washington Medical Center, and they've made a commitment to be a partner in public health as well. And we realize that all hospitals, all private industry, community partners, health department partners, we play a pivotal role. And so when there's an opportunity to partner on things like this, Gilead is ready to support organizations, and we're going to be here to support future efforts to be partners in public health. We recognize in this time that many of our health departments have been challenged, and many of our partners, had they not been screening, we would have seen major losses in the progress that we've made in the HIV epidemic further that we've seen. So far, we know that because of COVID, testing is down in the country about 20% for HIV testing, as well as viral hepatitis testing. And you all have heard about other preventive screening programs that have been impacted. As a result of these initiatives, we are making sure that testing is happening in communities wherever patients are being seen and that they have multiple touch points to access vital services.
Thank you so much, Angelique. The program is incredible. I think it's quite a testament to the work that you and Focus do through Gilead and community health centers and hospitals, that they created that video to talk about the good work that's being done. So kudos to you and your organization for continuing that great work. Again, you know, I think this epidemic has strained our healthcare system in such a way that as you know, routine testing has gone out the window. And I loved what was said about what you said about making testing routine and easy. And isn't that the key to healthcare and access and adherence, is making it easy and routine? You know, back in the 80s and 90s, when HIV and AIDS was first on the map in the United States, it was supposed to bankrupt the healthcare system. And what did we do? We innovated our way out of it. And I believe that, I've said this several times, we can't legislate our way out of this pandemic. We can't regulate our way out of this pandemic. We have to innovate our way out of this pandemic. And what a great illustration to see what has happened with HIV/AIDS and the work that you continue to do, how far we've come in that world. And so thank you so much for sharing the work that you guys do. I'd like to now go over to Lily Cappelletti with AstraZeneca, and they're at a different place in their path on community outreach and how we implement public health strategies to address current epidemics and pandemics. And this is a different one that I believe that Lily and her team are trying to tackle, and one that we've all been witness to over the last couple of years is a reckoning when it comes to public health inequities. And I'm really excited for you guys to hear Lily talk about the work that they have done, because I believe many tech council companies may be looking inward as well at what their organization can do, how they can retool, grab a different lens to look at their organization and the impact that they have in their communities, and how they can create new programs that make an impact. So Lily, I'll push it to you now, and we look forward to hearing what you have to say about AstraZeneca's work in this space.
Great, thank you, Nicole, and thank you, Angelique, for sharing the specifics on a really tangible example of how folks in our industry can partner at the community level. What I'm going to share with you is a little bit more macro in nature. And I think, Nicole, you're set up around just sort of pausing, looking inward, and thinking about holistically how private industry can help to advance health equity across the board is sort of exactly where we are. So I sit within the Advocacy and Alliances team at AstraZeneca in the US, and I'm sure many of you are familiar with us, but we do span all chronic diseases. And so in particular, as we thought about amidst the pandemic and some of the sort of external catalysts that happened in our external environment over the past couple of years, it's brought us to really pause and look inward and think about, as a pharmaceutical manufacturer and a distributor of medicines that is committed to transforming patient outcomes across chronic disease and oncology, what is our role in doing a better job of advancing to make sure that every person has an equal opportunity to their best health outcomes. And so, you know, there are a number of things that could be done on a transactional level, but as a function that is responsible for AstraZeneca's partnership with the patient and nonprofit community in the US, we chose to take a bit of an inward pause and look for a more transformative approach and really ask ourselves some hard questions about, if we are responsible stewards of AstraZeneca's dollars in the community, how can we be doing a better job of ensuring that those dollars are going to the folks that need it most and leading to meaningful changes in outcomes. And so, you know, we started by, and you know, as I reflect on this and trying to think about some of the key steps that we took, because I think it's a process we're still in the middle of, it's a journey, but hopefully some of the process is useful, and some of the questions we asked ourselves may be questions that I'm sure others have already are grappling with and continue to grapple with. So we'll try to think about this in terms of just sort of some of the steps we've taken and where it's led us so far. I think we started by asking ourselves, you know, are we delivering on our overall corporate ambition for all patients, which is really to ensure that all patients have access to the right treatment at the right time and have the ability to achieve their best possible health outcomes. And when we really paused and thought about that, we felt like the moment was right to address outwardly the fact that there are some systemic barriers that prevent individuals from having the same shot at the best health outcomes. And so how can we evolve as a team and as a function that is looking after how we invest in the community? How can we evolve our strategy to recognize some of those systemic barriers and think about ways that we can sort of, you know, just take more of a long-term approach to how we tackle these issues. And so we were balancing at the time, this was about 18 months ago, really an urgency to act in the moment with a recognition that health equity in and of itself is a long-term goal and not something that will be achieved overnight or really in the next few years. And so we did a couple of things. One is, and I think, Nicole, you said this at some point, the journey really starts with knowledge. So we wanted to look at what are we currently doing to support patients and communities sort of beyond the medicine and to help ensure that they're getting access to the right treatment at the right time. And then to bring in some external insight to help us understand of what we're currently doing, where are there gaps and where could we be doing more? And some of that might be just redirecting existing resources versus going out and you know, investing additional resource. So how can we evolve what we're currently doing? And then where are there gaps that do require additional resource or do require additional thought about the right partners so that we can be supporting efforts in the ecosystem? And so we built a strategic health equity advisory council, different than you know, the history of our company and sort of, I think our industry as a whole. We tend to put together advisory boards and they come together for 90 minutes and we ask them a whole bunch of questions and then they walk away and we walk away and we do what we will with their information, with, you know, the opinions they've shared. This was established from the get-go as a long-term relationship with a set of what's now 12 external advisors from across really the public health landscape. So that includes academia, it includes folks, former payers, former regulators, folks that work in the faith-based community, really wanted to add some different, as you said, Nicole, some different lenses to look at these challenges and where we could be impactful. And we've brought this council together now 4 times with some of our senior leaders within the company, with a particular focus in the short term for the challenge we were setting out to achieve, which was evolving our giving strategy to help us think about our reach, the cultural competency of the programs and partnerships that we deliver on, and are we working with the right trusted messengers? And so if we're trying to reach additional patients beyond those that we're already reaching, the same channels and the same tools and methodologies may not resonate in the same way. And so we needed to expand our network, and we needed some outside counsel to help us think about what are we not doing that we could be doing, and how could we make what we're doing already better and more relevant to additional audiences. So then I think where we are on this journey today is that we've brought that council together 4 times. What's ended up happening is that an initiative that started as a question about how can we better partner with the nonprofit community from an advocacy and alliance standpoint has grown to become how can we, our team has become really a catalyst for the rest of the organization to look internally at all the levers that a company like AstraZeneca brings to bear to address something like health equity. And we're now in the process of finalizing with that advisory council a roadmap that will include sort of a bold ambition and a set of very concrete measures around how we invest in the community and how we partner with community. But it will also include 3 other pillars. So we'll look at internally, how are we promoting a culture of inclusion and diversity, and how operationally, how are we centering our business around equity. It will look at our science, both research and development, as well as our medical affairs function. How are we centering those practices around equity? And then our delivery. So we're also a manufacturer and a deliverer of these medicines. So how are we ensuring that there's equitable distribution and equitable access? And so I think it's been a really nice, at times daunting, but a nice journey to sort of start from this question of, how do we support the external community and how do we do more from a philanthropic perspective, to then really sort of marshal all of the resources of the organization and think about how do we truly use everything that's within our gift and in our core DNA as an organization to address these challenges head on. We do plan in the first quarter of this year to have the sort of the culmination of that first year of work, which will result in this outwardly facing bold ambition that the entire organization will kind of cling on to around our commitment to advancing health equity across the organization, as well as later in the year, we will publish that roadmap, which will clearly break down within those 4 arenas of the business that I mentioned, the specific commitments that each will be making to influence and have some measurable impact to show for this work. It is a very long-term commitment. So I think it feels like we've done a lot of work, but we're still in the very beginning stages of that journey of starting to gather, internal information, external perspective, and put some of that perspective to use and start to hold ourselves to task. But I do hope that at the end of this, we will see more programs like the example that Angelique shared as an outgrowth of some of this sort of foundational work, which is to say, what are we really trying to achieve here, and how do we need to prioritize our resources to make sure that we make that measurable impact.
Thanks so much, Lily, for sharing your organization's journey. It's amazing how when one area starts to look at how do we step into this arena, how do we best utilize our resources to be a community partner to address inequities, that when a good idea is a good idea, it's contagious within an organization that is a responsible citizen. And this panel is talking about community relationships and implementing those strategies that really work. We're starting to get some questions in now from folks in the audience. And I'd like to ask, actually, I'm going to pivot now to Angelique and ask her a couple questions about focus. And I'm going to group a couple questions together. But one of them is, Angelique, how do you establish focus relationships? And how would a state legislator who's interested and supportive of the program be able to help you do what you do in that role? I know there are always questions in health inequities about transportation and things like that. So maybe that's an area where legislators could help with programs that assist in getting patients actually to testing locations where you're partnering with a hospital or a community health center. But let's go first and talk a little bit about how do you first establish these relationships? That's kind of a hard ask for some of these folks to retask how they've always done things to all of a sudden do them a little differently. So maybe you could address that a little bit, and we'll start from there.
Sure, Nicole. And focus is unique, I'll say, in the work that we do. We are a team spread across the country, Spain and Portugal, where we have regional directors who immerse themselves locally in the healthcare and policy landscape. We try to get an understanding of where the unmet need is in the community, and we meet different thought leaders and organizations during that process. And so often we have researched and saw and found that in a particular area, in a city or a county, there is a problem with late HIV diagnosis, for example, which is one of the reasons that routine screening has been recommended. And we will look at where are the organizations that serve the community. And often we are in hospitals because the communities are marginalized and are not able to utilize primary care where they might get preventive health screenings. And so we engage those organizations, their leaders, their emergency department directors, their chief medical officers, to talk about possibly addressing implementing screening and linkage to care programs within their institutions. And often we spend a lot of time sharing local epidemiological data. We share evidence about what the impact is on the community that they serve. And many times the hospitals in particularly have conducted a community needs assessment, and that will tell us what the big challenges are. And for the places that we tend to look at, we see that these conditions have emerged in these organizations on their own. And then we come in to try and fill in a gap. And so it is an extensive amount of relationship building. Each regional director is part of the community there. I am a native Baltimorean. I've lived in Maryland my entire life, born, raised, educated here at the University of Maryland school system for my bachelor's and my master's degree. And so part of our work is really about relationship building. And so we have, partners who tell us their challenges with doing things that they know are necessary because they don't have a priority or they don't have people who can look at these issues. And Focus comes in and provides the resources so that they can address whatever the unmet need is. If they think that they're doing screening as the recommendations say, they have someone who will analyze their data to confirm it. And often it's not happening at the rate that they expect. And so that's where Focus comes in and leverages the technology and works with the organization to use their existing workflow, their existing processes to offer screening routinely in a way that's normalized and it's destigmatizing, because stigma has really, been a big driver of epidemics because people will not feel comfortable going into certain settings and seeking the care that they need. And so through the work that regional directors are doing, we're kind of sharing the local epi, we're trying to dispel stigma, and we're trying to inform a busy healthcare system and many times where they just haven't prioritized this. They weren't aware, they didn't know that this was a problem in their own backyard. And whenever we encounter someone and we bring that to their attention, pretty much people get it, right? Immediately, they get it and they want to do something. And so that's the joy of working with Focus, because we just have so many committed people who really want to impact their patients and the people that they serve, whether it's in hospital or community. In terms of working with legislators, our partners, we encourage them to share their story. And particularly right here in Maryland, many of our partners, when we were starting out with Focus back in 2010, a challenge was around some of the interpretation of our testing laws. Many of our partners shared their issues with their legislators and, helped to bring about some change in policy. So often, the support is to make sure that, partners have resources, and particularly our public health partners. Health departments, I will say, are invaluable because they're the ones who are on the ground doing the follow-up on patients who fall through the cracks, particularly the positive patients, who may need to understand navigation resources and things like that. And so in terms of the transportation, that definitely is something a legislator could help with, because most of the public health departments will provide some assistance with that. But again, it's about what resources are available. And that is a challenge that is everywhere, whether you're in the city or in the rural areas.
Great. So I'm hearing that being supportive of local health departments is a huge tool that I think we all rely on in one way or another. I know my first vaccines were through my local health department, and I was so excited to see them up and running and, doing something that they weren't really designed to do. And so I give them a lot of credit, but I'm hearing that advocating for local health departments is critical to, I think, all of us really doing our jobs in addressing inequity in socioeconomic areas where have been traditionally marginalized in particular. So I want to go back. I'm getting some other questions from folks, but I want to take a step back and look at, if I am a Maryland Tech Council member and I am the CEO, or I'm the HR director of a small, medium-sized biotech company in Maryland, and I think to myself, we haven't really done anything in this space around dealing with health inequity or how our company is reacting to what's going on in the world. How do I start? Recognizing that we're all in different roles and our organizations are all in different places. What would your advice be to some of our companies if they wanted to start looking inward, if they wanted to make that pause and create some form of unit within their organization to look at how they could play a larger role, create a policy that would be implemented locally or in their community? And maybe I'll start with Lily on this one, and then we'll go back to Angelique. What would your advice be to them, since you have just kind of done this initial work with a much larger organization, probably? But what would be your first maybe recommendation to them on kind of where to start?
Yeah, it's a great question, and I don't have the magic answer. I think reflecting on my own experience, I think you can only really start with what you know. And so we started with just bringing together a few functional leads internally to try to capture what are we doing, and what are the, if we think about our organization as an employer, a manufacturer, a deliverer of medicines, and then a player in the healthcare ecosystem and a community partner, can we have some representation from sort of each of those areas of the business and just start to capture what are some of the things that we're currently doing today that if we, looked at them are, there's some element of trying to recognize that there are inequities and build that into the strategy or the approach. And just starting to get an accounting then starts to paint a picture of, what you're currently doing, and then gives a little bit of a foundation for bringing in other opinions, external insight, other folks from around the company, just to sort of take a look and start to think about, identify a couple of common themes and a couple of gaps. And then I think once you've got a bit of an internal accounting, it does help to get that external perspective. I think the advisory council that we built, which again, it's not a big investment of dollars. I would say it is a big investment of time, because you've got to really steward a council like that and be really clear with your external advisors what questions you're looking to help them, or you're looking for them to help you answer. They've been really helpful in sort of taking a look at our existing internal accounting of what we're doing and helping us to choose which problems we want to solve from here, because, you know, health equity in and of itself is a very large and lofty goal. So I think that's a good starting point, just trying to get a couple of key decision makers and leaders from around your organization together to do an internal accounting, and then identify a couple of folks externally that you may have existing relationships with, or know about in the ecosystem that you could invite in for a conversation, just to start to think about what's possible.
Thanks so much, Lily. That's a great answer. And I think it's a very attainable one, right? Like if somebody gives you a goal that you just know that you can't achieve, you're like, oh, I don't know if we can do this. But I think that's a great place to start. And Angelique, I'll let you answer this as well. I think you guys are a bit further down the road in kind of implementing a public policy that has now worked and is a real success story. But what would your advice be to, even a freshman legislator or a small business that's looking to find their role in how we address this?
I agree with Lily. I think that, you've got to get in the know and you've got to look. I would say that here at Gilead, we're always listening to our partners, trying to be attentive and understanding things and perspectives that we might not see obviously. And like I mentioned, even in how we develop partnerships, often it is a thing that people just don't know and they haven't looked closely at it. And so that first step is really trying to get an understanding of, where you are, what's the landscape like, and where do you fit in, and how can you contribute, and starting with yourself, how can you support an issue that may pertain to you? Gilead, we support globally HIV efforts around health disparities and inequities, and we've done so for decades. And so this is something that we're committed to, but it's not easy. You don't always pick and find the right aspect that needs to be addressed, but the goal is to kind of be at the table. And I agree with Lily, it does take time. In my role as a focused regional director, we are looking to address health disparities by where we partner, by the communities that we pick, and it takes time. We sit on community coalitions, planning bodies, where we're just there and we're listening and learning and hearing from people. And I know for myself, when we started our hepatitis C screening initiative, I was attending one of the Maryland No Wrong Door substance use treatment committees. And we learned so much just from the members of the community who said that what's happening about hepatitis, we're doing all this testing for HIV, we have so many resources, and the federal government does provide significant resources for HIV. And through my listening to them, that's how I started to support behavioral health programs and to fund syringe exchange programs for testing. And so it is, a thing that takes time. It takes sometimes you just trying to fit the puzzle pieces together, because like you said, Lily, this is a huge task. And the first step is to listen, to learn, and then take what you've learned and tie it to something that you feel, passionate about, committed to, and you'll have success in it. And I feel like, the Focus Initiative was started by passion. The people who looked and identified these issues were passionate about this, and that's why we've been so successful.
And it's as if Angelique is reading my mind. I must be fully transparent this morning. Our last question actually deals with passion and what drives your passion for this work. How can we spread the energy and passion to ensure the work is sustainable? And I think that's really important. That's a key piece. We've talked a little bit about, and I loved, Angelique, what you said is starting with yourself. because we all have a responsibility, not just in our roles, but in our humanity to reach out, to be part of our community, to address local need. And with being parts of organizations that are dedicated to it, we actually have dual roles here that we can take advantage of. We've talked a little bit about lenses, looking with different lenses. We've talked a little bit about these journeys start with knowledge. But I think the crowd would like to hear, and maybe I'll go to you, Lily, about what makes you passionate about this work, because it's not easy work. And so, what drives you to do this every day?
It's a great question. I could answer that in so many different ways, depending on the day too. But I think, where I originally got into this work was actually in field work abroad. I spent time in Madagascar working on actually HIV screening programs. And I think what what landed me where I am today is just seeing the immense resource and potential that the private sector has to be able to bring those resources to bear to solve public health challenges. It's just the opportunity there is immense. And despite all of the great work that needs to happen on the ground at the community level, we will never have enough resource to do it as sort of one sector. It requires multi-sector collaboration. And so I think to be in a place that has so much resource and so much infrastructure, there's an enormous responsibility to channel that resource for the public benefit. And so I feel in such a position of privilege to be able to help to make some decisions about where those resources get used and how they get channeled, and to make sure that as Angelique said, that there's a listening component in all of this, that the challenges we're trying to solve at the end of the day, these are people that we're trying to work with, and we're all people. And so it requires listening to those people that you're trying to work together with to achieve some of these objectives. And I think that's what really drives me, is I know that I have the unique privilege to be able to sort of open the door and funnel some of these resources and infrastructure and expertise out into the community. And so that's a huge obligation and a huge privilege. And I consider myself just very lucky to be in a place where I get the opportunity to bridge those two worlds and really live the multi-sector collaboration that I think is critical to really addressing any of these large systemic societal issues.
Thanks, Lily. Just watching both of your body languages when you talked about why you're passionate about your work. They say when we look down, we look inward, and when we look up, we look outward. And both of you looked up when you were answering that question about where you find your passion and how do you make it sustainable. And I think if we employ it every day in our lives, in our professional lives, that we do keep it alive. And so I thank you both for your candid comments, the work that you do. We are done with our questions, I believe, Kurt and Cindy. But the one thing that I think I'd like to end with is earlier in the PhRMA video, they talked about, I think the quote was, when we embrace diversity as part of our DNA. And I'd like to add a little bit of that when we embrace diversity and community as part of our DNA. This morning, I was listening to on one of the public radio shows about a judge and how she was trying to change the way and look back at things that she might have not caught or done wrong, and how as a judge, they don't have a whole lot of flexibility, but they do have a flexibility in being more parts of the communities where they make judgment. And I think it was so important listening to that and coming into this conversation, that unless we make our communities part of our daily DNA, there's no way that we can help them or address their need, because we don't know what it is. And so in my role at PhRMA, one of the things we have done and dedicated recently our time to is inclusivity in clinical trials and guidelines as to every person of every walk of earth that needs to be included in clinical trials and how incredibly important that is. It's something I'm very passionate about. But I think it blends in very well with the work that both of your organizations are doing. I know we're very, very thankful at PhRMA to have you both as members, and very thankful to the Maryland Tech Council for giving us this great opportunity to talk about the work that we're so passionate about. And hopefully we have served as a resource in some way. I know I will make myself and PhRMA available for any questions or follow-up, and I know Angelique and Lily will do the same. So thank you, Maryland Tech Council. We look forward to working with you in the future. Thank you for all you do.
Thank you.